continue.
Doctor, I got 25, but
Who is
I
speaking?
just missed only one homework.
What's your name?
Hussam Amin.
Hussam? I mean,
Yeah, Al-Sayyid Amin
25.
Hussam Ahmed.
Yes, so this is 9 for the first paper, 6 for the second, then 0 because I didn't see it, 10 for the last week paper. So that is why it's 25. Mhm.
For the last week paper, I attended, I submitted. I just
So
didn't
it's
submit for the
10,
second day.
10 points, yes. You didn't submit the paper for the week, for the
Second.
2nd of February. So when we have
Yeah. For the second
classes.
paper, I will send it today. I told you, so I'll send it today.
Yes, do it, please. Well, now let's go to the slide. Mhm. And Tariq. Mhm. And well, so the person complains of breathlessness. We've discussed this. Yes, Anurin, what kind of information did you get about the history of presenting complaint? So let's focus on.
Number 5, yes.
Anurin, please. Mhm.
Number 5 is night in the morning. Number 6 is morning.
Mhm.
And 7 is 3 times per week.
Okay.
And number 8 is tightness.
Yes, chest
And number
tightness.
9 is pain. Yes, number 9 is pain.
Number 9 is, sorry, what?
Pain.
Pain. No pain
No
precipitants.
pain. Yes.
Uh,
Yes.
and what about number 10? Mhm.
I'm not sure about infection.
Well, actually, so he says no, number 9, no known precipitants. So it means he didn't notice anything. And history suggests, what does the history suggest? I mean, if it is breath, yes? As a doctor, as you can see the symptoms and signs. So
Infection?
Infection. Okay, maybe infection. Any other ideas?
Yes, asthma.
Asthma. Okay, asthma is also possible. Thank you. And if we look at the post-medical history, let us listen to Amar. What is 11?
11. Heart attacks.
Which attacks?
Heart.
So who has got this information?
Previous.
No history of previous attacks. Yes, he says this is the first time I'm ill, he says, right? And family history about mother and sister, what kind of problem do they have? Yes, Noha, please. Noha? Will repeat, please. Yes, eczema. Eczema, yeah. Okay, so this is the information just about part of the information. And if we look at the next slide, there is a question. What does Mr. Bloomfield say about things that trigger the attacks? Anurin, what things trigger the attacks? Anurin, are you here?
Yes.
Is there anything that can trigger?
Maybe work.
Maybe, sorry, what?
work, stress at work,
Okay, so Mohammed Isar, please.
Yes, yes, he has a problem in work, and this cause a change and the pain when he think about these problems in work.
Mhm. So you're commenting on problems at work. Okay. So what about the next idea? If he's had any infectious recently? Infections?
No, he hasn't.
No. Mhm. And about taking any medications, Aboli, what does he say about taking any medications? Aboli, hello? Aboli is absent, right? So this is minus.
No, doctor, I'm here.
You're here, really. So do you remember anything about taking medications? Does he take any medication, any drugs?
No, he didn't tell about medication.
No medications. What about physical activity?
No, he didn't do any exercises.
Right. So what about pets?
He didn't have pets, but his neighbor have a cat.
Okay, but he doesn't actually see the cat.
Yes.
Well, so the next is for Rufaida. So we've spoken about problems at work. What about mortgage? So do we understand the meaning of this word mortgage, Rufaida?
No, I don't.
So you can see the illustration next to this line. This is a house. Actually, mortgage, this is the agreement between a person and between a person and a bank, that the bank provides money for the person to help him to buy a house, an apartment. So and then but the bank has the interest, and then so this person just pays the money back to the bank every month. So this is the mortgage. What does he say about the mortgage? Who remembers? Is he
I think he
worried?
said everything
Yes.
fine.
Sorry?
I think he said everything is fine.
Everything is fine with in the family, right? But so as we already said, he has some problems at work. It means that he if he has problems at work, everything is changing so fast. He's not sure whether he'll be able to pay the money back to the bank. So that is why he's worried about mortgage, and he's stressed. So, and this causes some problems with health. Well, yes, and so you see that the locum general practitioner asked a lot of questions. And why are the past medical history, family history, social history, and drugs and allergy history important? Yes, Hussam, please.
Because it will be equally for any stressness for his life. If there's a family history or a problem at work, and for the medical history, if he take any drugs at home or anything, which is can help the doctor to know if there's any friction for any other drug. Yeah.
Yes, there is some information about triggers of this condition about allergy. Okay, yes, it will help the doctor to in the treatment anyway. Well, and so there was information about signs and symptoms, and let us try to differentiate between signs and symptoms. If we speak about a sign, this is an indication of illness that the doctor sees, but which is not apparent to the patient. This is a sign of a disease. If we speak about a symptom, this is what the patient notices himself or herself. And so sometimes signs can be classified as symptoms and vice versa. Sometimes it's not so obvious, the difference. And so if we move to the next slide, we can see here the description of a condition. And so there are 5 aspects here, and we should decide whether these are signs or symptoms of a disease, or some may be both sign and symptom. So if we ask Tariq, will you comment on this condition, please? Tariq, hello.
Yes, doctor, yes.
Mhm.
I
What
think
about-
this is a cough.
I mean, here, can you see the slide?
Yes.
Is blocked nose a sign or a symptom?
A sign.
What about the other line?
Raised temperature.
Yes.
Symptom.
Okay, then
Tender over cyanosis. I don't know about this.
the fourth line. Do you know the fourth line? Headache, worsen,
Sign.
sign. Okay, and runny nose.
Sinus.
Well, and here is the information. So what is, I mean, what a patient can see, this is a symptom, yes? Blocked nose, just headache, worsen, bending, runny nose. Maybe sometimes a patient can't notice the raised temperature. And of course, the doctor can understand that there is a tender over cyanosis. So these are 2 signs here. Okay, and the other condition, condition B here, is Emma here? Emma?
Yes, I'm here. Yes.
Okay, so please, Emma, will you comment on condition B? Are these...
The raised temperature is a symptom, and the diarrhea and recent vomiting, it's a sign, and the dehydration, it's a sign, and abdomen tenderness, it's a sign, and the crampy abdominal pain, it's a symptom.
And let us check. So yes, so the patient can feel the raised pulse, yeah, and vomiting and diarrhea and pain. So, but sometimes maybe only the doctor can understand that the patient is dehydrated. Yes, who is speaking?
Raised in birth, maybe it's sign, because there's some people didn't notice the raised.
Raised pulse may be a sign. Okay, yes, so you know better. I see, yes, sometimes the people do not understand. Good, thank you. And so the question, which diseases the signs and symptoms might relate to? So condition A and condition B. So any ideas? Abdul Rahman, condition A. Abdul Rahman, hello. Are you here?
Can you hear me?
So please, blocked nose, raised temperature. So what is the disease?
Blocked nose, raised temperature.
All these.
I think it's a cold or a flu.
Yeah, exactly. Yes. Or sinusitis. Right. Okay. So condition B here. Amar. Amar.
Oh yeah.
Mhm. So what do you think of this condition? What is the disease? You as a doctor, how are you going to treat this person? What is your diagnosis?
Second.
Yes? What is it?
To raise ball, to raising vomit, diarrhea, dehydration, abdominal.
What is the disease? There's a pain in the abdomen. So
I don't know.
you don't know. Okay, who knows? Who can help us? So, well, if there is pain in the stomach, so can it be, for example, I don't know, appendicitis? Appendicitis? Yes, possible. Can it be gastritis? Also possible. Okay. Well, and so the next slide here. Yes. On your own, make a list of the signs and symptoms you would expect to see in a patient with pneumonia. So please think of signs and symptoms. And so just a minute for you to do it individually, and then we'll check together, okay? So start, please. Okay. So, Aboli.
Yes, doctor. About the sign and the symptoms of pneumonia, it may include cough, fever, sweating, shaking chills, and shortness of breath, and rapid shallow breathing, and the loss of appetite, and low energy, and fatigue, and
Okay.
sometimes vomiting.
You are speaking about symptoms, right?
Yes.
And the signs, the condition that can be, that only the doctor can see.
Yes.
Signs, what are they? Okay, we were speaking like about the increased temperature and so like raised pulse. So, and somebody says that the doctor can only recognize this and says that this is a sign. Okay, Well done, thank you. So you understand what to expect from patients, and you can understand the meaning of these signs. And now let us just let us speak about the language that the doctors use when they talk to a patient. So when you speak to a patient, you need to use non-technical language that the patient can easily understand. And so here are example questions from the case history. The question, which verb means precipitate and which means start? So the verbs and questions which are highlighted here, given in bold. So in the first question, when do the attacks come on? Is it precipitate or start? Okay. So Noha, what do you think?
Start.
Yes.
Come on, means start.
Okay, come on means start. And in the second, are you aware of anything that triggers the attacks? So it means precipitate. Yes, trigger, precipitate. Okay, and well, so here we have some practical exercise of using non-technical words. We should replace the technical words in italics, they are highlighted here, with non-technical words from the list. The list of words is given to the right. So you may have to change the form of the word. For example, if we look at the first sentence, let us read it. Isar, please. Read the sentence.
Yeah. We are going to have to perform a few tests. I guess it will be do.
Exactly. We're going to have to do a few tests. Yes. So instead of before, which is like a formal or just in this situation, this is a medical term. It's better to use do just to make it clear to the patient. Well, please look at the other sentences and let us do it individually. 2 minutes for you to replace the highlighted words with the, some phrase from the column to the right. Start, please. Now. Hussam, are you here?
Yeah, I'm here to.
Well, let us read the sentences with the non-technical words now. Yes, Samar, please.
Okay, suffering from, it's gonna be have or have got.
Mhm. And so in this sentence, I mean that, should we change the form of I have got? If we speak about she, will you read the sentence?
She has got,
I forgot. Mhm, okay,
she has got a very bad
I see. Okay,
bout
good.
of flu.
So Anorin, please, the next sentence.
It might be a good idea to avoid fatty
Mhm.
foods for a while.
Okay, so Isar.
Number what?
Number 4. Mhm.
Number 4, stick to
So he's
or
mm,
admit. Stick to or admit.
instead of susceptible, yes, well, instead of yes, Noha, what is it?
Admit.
Mhm. So
Prone teacher.
yes, Rofaida, what do you think?
It's prone.
Yes, so he's prone to many minor illnesses. Well, the next is for Abu Ali, please.
Okay, you said the cough is intermittent. I think it will be come and go.
And if we say the cough, this is the third person singular, what should we add to the verbs? So you said the cough
I said to come and go.
comes and goes, right? So
Yeah,
we're speaking
yes.
about cough. Mohammed Ali, number 6 is for you, please. Mohammed Ali, hello. Minus is absent. Well, Noha, please.
Yes, your cough is persistent. Persistent mean that they're all the time.
Mhm. So your cough is there all the time, you should say. Okay, Rofaida, please. This is 7, right?
It's difficult to admit any kind of life change.
It's difficult to, sorry, what? Admit.
Admit.
What if we choose another phrase here? Instead of admit, it's difficult to
Do.
or yes, Noha?
Stick to.
To stick to, yes. Any kind of life change. Okay, so Tariq, please, the next sentence. Tariq, hello.
Yes, doctor. You won't have to be admit.
To be admitted, like admitted in a hospital. Okay, and so Emma.
Okay. You are scheduled to see the nurse in the allergy clinic next Thursday. You are booked to see the nurse.
You are booked, yes. So,
Booked,
well, these are some of the words that should be used, and anyways, we should understand that doctors should use simple language. And let us just try to role play a short conversation, and we should use some phrases to make questions with non-technical words. and we should role play a conversation between a doctor and a patient with a flu or cough. So there are some examples of sentences, questions. Are you prone to? Are you booked to see? Do you find it difficult to stick to medication? Does your cough come and go? Have you ever had? So who will be a doctor? So we need two people, two students. One of them will be a doctor and the other will be a patient with the flu. So who is eager to role play the conversation? Okay, anyway, so you are future doctors. So the doctor, let us ask Hussam to be a doctor and Abdelrahman, a patient with the flu. So please, doctor, start.
I just should ask him some question, right?
Yes, yes. So you see the patient, how do you start the conversation?
Hi, what's your name? And
Abdelrahman.
My name is Abdurrahman. Abdurrahman Majid Hassan.
could you tell me what's the problem and when it start?
2 days ago, my nose was runny, and I had a fever.
Do you know why did it came to you, or is there any bits in your house, or you have any allergic from a bits or anything?
No allergies, but I think it started when I took a cold shower and forgot to dry off my hair.
Like, just like that. I don't know. So you got a fever from being to get cold at night and didn't.
So the patient just helps you with the diagnosis, right? So, and you should just give him some recommendations what to do, doctor.
About like a medicine or
I don't know.
like that. I don't know also. So I think he should go to the to take some medicine.
You should prescribe something to the patient, right? And give some recommendations on what to do.
He should be dry at night.
Yes.
You shouldn't do like that again and being dry after taking a shower. And yeah, just like that.
Okay. So good. Thank you, gentlemen. Very interesting to listen to you. Now, yes, we should pause